Health-related phobias are intense, irrational fears centered around health, illness, or medical procedures. These fears can range from worrying about catching a disease to being terrified of visiting a doctor. People with these phobias often experience anxiety that interferes with their daily lives. It's important to recognize that these fears are not just simple worries, they can be overwhelming and persistent, sometimes leading individuals to avoid necessary medical care. In this video, we'll explore the different types of health-related phobias, their causes, and how they impact people's lives. There are several common health-related phobias that many people experience. Some of the most well-known include hypochondriasis or health anxiety, where a person constantly fears having a serious illness. Others might fear specific diseases like cancer or HIV, while some are terrified of germs or contamination. These phobias can manifest in different ways, but they all share a common thread: an overwhelming fear related to health or illness. Understanding these common phobias is the first step toward recognizing and addressing them. Hypochondriasis, also known as illness anxiety disorder, is a condition where a person is preoccupied with the idea that they are seriously ill despite medical reassurance. This phobia can lead to frequent doctor visits, constant self-examination, and excessive health-related internet searches. The anxiety can be so intense that it disrupts work, relationships, and daily activities. People with hypochondriasis often misinterpret normal bodily sensations as signs of severe illness, fueling their fears even more. Nossophobia is the irrational fear of developing a specific disease, such as cancer, heart disease, or AIDS. Unlike general health anxiety, nossophobia is focused on one particular illness. This fear can be triggered by hearing about someone else's diagnosis or reading about symptoms online. People with nossophobia may avoid hospitals, medical shows, or even conversations about illness. Their daily lives can be significantly affected as they try to avoid anything that reminds them of the disease they fear. Germophobia, also known as mysophobia, is the fear of germs, dirt, or contamination. People with this phobia may wash their hands excessively, avoid touching objects in public, or steer clear of crowded places. The fear of getting sick from germs can be so strong that it interferes with normal routines. Germophobia often overlaps with obsessive-compulsive disorder, but it can also exist on its own. Understanding this phobia helps us see how deeply health fears can affect behavior. Iatrophobia is the fear of doctors or medical professionals. This phobia can make it extremely difficult for people to seek medical help, even when they need it. The fear may stem from a past negative experience, fear of bad news, or anxiety about medical procedures. People with iatrophobia might avoid routine checkups, delay treatments, or experience panic attacks at the thought of visiting a doctor. This avoidance can have serious consequences for their health. Denophobia is the fear of dentists or dental procedures. Many people feel some anxiety about dental visits, but for those with denophobia, the fear is intense and persistent. They may avoid dental care altogether, leading to worsening oral health. The fear can be triggered by the sound of dental tools, the smell of a dental office, or memories of past pain. Overcoming denophobia often requires understanding the root cause and seeking support. Trypanophobia is the intense fear of needles or injections. This phobia can make routine vaccinations, blood tests, or medical treatments extremely stressful. People with trypanophobia may faint, experience panic attacks, or avoid medical care altogether. The fear often starts in childhood and can persist into adulthood. Understanding this phobia is important, especially as medical procedures often require injections. Support and gradual exposure can help manage this fear. Hemophobia is the fear of blood. For some, even the sight of a small cut can trigger intense anxiety, dizziness, or fainting. This phobia can make it difficult to handle injuries, medical procedures, or even watch certain movies. Hemophobia often develops after a traumatic experience involving blood. It's important to recognize that this fear is real and can significantly impact a person's willingness to seek medical help when needed. Thanophobia is the fear of death or dying. While it's natural to think about mortality, people with thanophobia experience overwhelming anxiety about their own death or the death of loved ones. This fear can lead to avoidance of anything related to illness, hospitals, or funerals. It can also cause sleep disturbances and constant worry. Understanding thanophobia helps us see how health-related fears can extend beyond physical symptoms to deeper existential concern. Health-related phobias can develop for many reasons. Some people may have had a traumatic medical experience in the past, while others might have learned these fears from family members. Media can also play a role, especially when stories about diseases or outbreaks are widely reported. Genetics and personality traits such as being more anxious or sensitive can increase the risk. Understanding the causes can help in finding effective ways to manage these phobias. People with health-related phobias often experience both physical and emotional symptoms. These can include rapid heartbeat, sweating, shortness of breath, and dizziness when faced with their fear. Emotionally, they may feel intense anxiety, dread, or panic. Some people also develop avoidance behaviors, steering clear of situations that might trigger their phobia. Recognizing these symptoms is important for seeking help and understanding the impact on daily life. Health-related phobias can have a major impact on daily life. People may avoid work, social events, or even family gatherings out of fear of getting sick or encountering medical situations. This avoidance can lead to isolation, missed opportunities, and strained relationships. In severe cases, it can prevent people from seeking necessary medical care, putting their health at risk. Understanding the real-life impact of these phobias highlights the importance of addressing them. Diagnosing a health-related phobia usually involves a thorough evaluation by a mental health professional. They will ask about your fears, how long you've had them, and how they affect your life. Sometimes, physical exams are done to rule out medical conditions. The goal is to understand whether the fear is a normal concern or a phobia that needs treatment. Early diagnosis can make a big difference in managing symptoms and improving quality of life. Cognitive behavioral therapy, or CBT, is one of the most effective treatments for health-related phobias. CBT helps people identify and change negative thought patterns that fuel their fears. Through gradual exposure and coping strategies, individuals can learn to manage their anxiety and reduce avoidance behaviors. CBT is often tailored to each person's specific phobia, making it a flexible and practical approach for overcoming health-related fears. Exposure therapy is another common treatment for health-related phobias. This approach involves gradually and safely exposing a person to the source of their fear, helping them build confidence and reduce anxiety over time. For example, someone afraid of needles might start by looking at pictures of needles, then progress to being in the same room as a needle, and eventually receiving an injection. Exposure therapy is often done with the support of a trained therapist. In some cases, medication can help manage the symptoms of health-related phobias. Doctors may prescribe anti-anxiety medications or antidepressants to reduce severe anxiety and panic attacks. Medication is usually used in combination with therapy, not as a standalone treatment. It's important to discuss the risks and benefits with a healthcare provider to find the best approach for each individual. There are several self-help strategies that can support people with health-related phobias. Practicing relaxation techniques such as deep breathing or meditation can help manage anxiety. Keeping a journal to track fears and triggers can provide insight into patterns. Setting small, achievable goals for facing fears can also build confidence. While self-help is valuable, it's important to seek professional support if the phobia is severe or persistent. Support from family and friends can make a big difference for someone dealing with a health-related phobia. Loved ones can offer encouragement, help with exposure exercises, and provide a listening ear. It's important for supporters to be patient and understanding, avoiding criticism or pressure. Open communication and empathy can help build trust and make the journey to overcoming a phobia less lonely. It's important to seek professional help if a health-related phobia is interfering with daily life, causing significant distress, or leading to avoidance of necessary medical care. Mental health professionals can provide diagnosis, therapy, and support tailored to each person's needs. Early intervention can prevent phobias from worsening and improve overall well-being. Remember, seeking help is a sign of strength, not weakness. Health-related phobias can affect children as well as adults. Kids may develop fears after a medical procedure, illness, or hearing about diseases. These fears can show up as tantrums, avoidance of school, or physical complaints like stomachaches. Parents and caregivers play a key role in supporting children, offering reassurance and seeking professional help if needed. Early support can prevent phobias from becoming long-term issues. Older adults can also experience health-related phobias, sometimes triggered by age-related health concerns or medical experiences. These fears can lead to isolation, reluctance to seek care, or increased anxiety about aging. Support from family, friends, and healthcare providers is essential. Addressing these fears can improve quality of life and ensure that older adults receive the care they need. Media coverage of diseases, outbreaks, or medical issues can sometimes fuel health-related phobias. Constant news about health risks can increase anxiety and make fears feel more real. It's important to balance staying informed with taking breaks from media when feeling overwhelmed. Understanding how media influences our fears can help us manage anxiety and focus on reliable sources of information. Social media can amplify health-related fears by spreading misinformation or sensational stories. People may compare their symptoms to others or become anxious after reading about rare diseases. It's helpful to limit time on social media and follow trustworthy accounts. Being mindful of online content can protect mental health and reduce unnecessary anxiety. Cultural beliefs and values can shape how people experience and express health-related phobias. In some cultures, discussing illness is taboo, while in others there may be strong beliefs about certain diseases. These differences can affect how people seek help and cope with their fears. Understanding cultural context is important for providing effective support and treatment. Stigma and misunderstanding can make it harder for people with health-related phobias to seek help. Some may feel embarrassed or worry about being judged. It's important to remember that phobias are real mental health conditions, not a sign of weakness. Reducing stigma through education and open conversations can encourage more people to get the support they need. Living with a health-related phobia can be challenging, but it's possible to lead a fulfilling life with the right support and strategies. Building a strong support network, practicing self-care, and seeking professional help can make a big difference. Remember, progress may be gradual, but every step forward counts. With understanding and patience, people can learn to manage their fears and enjoy life more fully. Many people have successfully overcome health-related phobias with the right treatment and support. Hearing about others' journeys can be inspiring and offer hope. Success often comes from a combination of therapy, self-help strategies, and encouragement from loved ones. These stories remind us that change is possible and that seeking help can lead to a better quality of life. There are many resources available for people struggling with health-related phobias. Mental health professionals, support groups, and online communities can offer guidance and understanding. Educational materials and hotlines provide information and immediate support. Reaching out to these resources is a positive step toward managing fears and improving well-being. Health-related phobias are more common than many people realize, but they are treatable. With understanding, support, and effective treatment, individuals can learn to manage their fears and regain control over their lives. If you or someone you know is struggling with a health-related phobia, remember that help is available and recovery is possible. Taking the first step towards support can lead to a healthier, happier future.